Testing, testing. Good. All right, looks like we're recording. So we're in clinic. Good morning.
Hello.
It's almost afternoon, right? So need to ask your legal permission. We're going to talk to you, and we're recording everything, so don't share anything personal or private, not your last name. We'll just talk to each other by first names. And don't give me your credit card number or your social security number, your address, your bank account number, or anything like that. But the idea is that we're testing out the live broadcast again with the idea that then those of you who don't live in town, you could come to clinic basically on Tuesday mornings, and we would be broadcasting live. So this morning's a test of the, what do they call it, the emergency broadcasting system. This is only a test if you were really in clinic. Anyway, so we're going to try that this morning. And first thing we do on the day after surgery like this is give thanks. Yesterday, the surgery that you had is major life-threatening surgery. People having the kind of surgery you have occasionally lose their lives. Occasionally we have death, complications like bleeding or infection, respiratory problems, things like that, and we had none of that yesterday. So we take a moment to give thanks for that, for the blessings of everyone doing so well. And we know we have some kind of bumps and bruises and things like that from yesterday, but on the other hand, you had major surgery. And we look like we're on the threshold of massive weight loss, protection from some of the serious illnesses of sleep apnea and diabetes and things like that. So again, we're happy everything went well, and then we'll go through and interview each of you, kind of answer questions about your surgery and talk about things. And first things first, Teresa,
Yes.
you're back.
I'm back.
And you had how was last night? Was it rough or?
Last night, that's when my upset stomach started.
Right, we
And
were
I
talking
was
about that.
like, okay, maybe I should start. I didn't take any of the medicines yet, so I took the Prilosec and the Pepto-Bismol, and it
Right.
didn't help at all.
Right, so
I was
let's
drinking and eating crackers and.
talk about the pain or the discomfort of the upset stomach. And that's one of the things we always work on, because sometimes telling somebody about a symptom is difficult. So we want to kind of tease that out a little bit. So you have you said upset stomach. So burning pain, or would
Like,
you
it's
say
like you know when your stomach growls, kind of like that.
yes?
But it's up here.
Yep,
And I
like in the
hear it.
chest kind of thing.
Yeah.
But would you describe it as pain?
It's really uncomfortable.
It's uncomfortable, okay. Again, telling one person or another the discomfort. Remember we talked to you, and the nurses talked to you yesterday about the number system?
Oh, right.
And remember, number 1 is you stubbed your toe or you had a paper cut, something mild. And number 10 is you are run over by a bus, you're set on fire, you're shot with a gun. So this discomfort that you had yesterday, can you give it to help us understand?
3 or 4, I think.
3 or 4, gotcha. Okay. And funny, 'cause you kind of describe it in your chest, but it's almost like an indigestion, upset stomach. Did I hear you say?
Yeah, I think it feels like, when you're hungry,
Yes.
your stomach growls like that.
Yeah.
So I was hoping maybe if I ate something.
It might help it.
Yeah, and
It
it
didn't.
actually makes it worse. a
Right,
little bit.
right. So sometimes when you swallowed something, it actually increased the pain from a 3-4 to a 5-6, would you say? Or
Yeah.
something like that. Okay. And so your question is, should you expect that? Is that what we expect and things? And what should I do?
Go away.
Well, let me tell you, we want to educate you about what happened yesterday, and I want you to think about, instead of the surgery I did on your stomach, imagine that instead we had surgery on your thumb. And imagine that I cut off the tip of your thumb with a saw. And then I put stitches in it
Uh-huh.
and staples in it.
Oh.
Imagine how that thumb would feel this morning. Now put food on top of it, on top of that open wound,
Oh, gosh.
right?
Yeah.
Now go back. If you had to give that a number in your mind, making up that thumb, to me, I would give that a high number.
Yeah.
I don't know if it'd be 10,
Uh-huh.
but it would hurt. While you were asleep yesterday, we did that to your stomach.
Uh-huh.
We took your stomach and put it in a pair of pliers and crushed it. Then we fired staples through it. Hundreds of staples. Uh-oh. Oh, well. It's no problem. We have blood and all kinds of things happen on the floor, so.
Okay.
Hey, Sandy, could I ask you a big favor?
Sure.
Could we get a towel or two? We lost some Gatorade on the floor.
Okay, no problem. My water
And-
broke.
and
Where's
can,
your charge for that?
and can we? And I'll take the charts when you get a chance too. Thanks.
Sure, let me get those to you real quick.
All right, thank you.
You want me to get the towels? Oh, do you have me over here? Thank you. I appreciate it. sit
No,
down.
no, 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 no,
Up,
no.
up, 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 up.
Just,
Over.
yeah, thank you.
How about I give you this?
That's wonderful. Thank you very much. So, let's go back to your poor little stomach. While you were asleep yesterday, and how was your anesthesia?
It was good. I mean, I don't even remember being rolled into the operation room.
You're welcome. In other words, right? Isn't that what you want from anesthesia?
They would start it when I was in the operation room, but he was already giving me all this stuff, and before I knew I was out.
Yeah?
And then I woke up and like, oh.
Well, a lot of people, what do you fear from anesthesia? You fear that you'll be awake, that you'll feel pain or things like that, or you'll remember something awful. So your anesthesia went great.
Yeah.
I wonder what we said while we were out there.
All right, we got your bank account and your social security number. And so that's a good thing from your anesthesia. But while you were asleep, remember this mask man was doing kind of bad things to your stomach. We grabbed that stomach really with like a pair of needle nose pliers and just crushed it. And then we fired staples into it, hundreds of little titanium staples. 6 rows of titanium staples all the way from the bottom of the stomach to the top, creating that new, long, narrow stomach, right? And then we took a razor blade and slit it and cut it. Okay? Then since surgery, you've been putting food on that wound, right? And it's pouring, plus it makes acid. So the fact that you have some discomfort, I'm really sorry about, but I know who caused it. And I apologize.
And in a year you'll drink them.
But it's not surprising given the magnitude of your surgery. We don't want you to have this pain and discomfort. I don't want you to have any. But it's not too surprising. And what's even more surprising, though, if I had done that to your thumb, you wouldn't be chatting with me in a smiley, friendly way. You can look, your face doesn't look like you're wincing in terrible pain. If you had done that to my thumb, can you make the face of pain? Right? You're not kind of laughing and chuckling if you have that. So when God created heaven and earth, we give thanks. He didn't put many sensory nerves in that stomach wall. So it allowed me to do that surgery with a small amount of pain and discomfort. Now another funny thing that you said is it was in your chest, but I didn't operate in your chest, did I?
Right.
And that's called referred pain. And again, that's because of the lack of localization of the nerves that God put in the chest and the abdomen. You can't localize it as well. If I touched your thumb versus your finger, you can tell that difference. And you can even tell if I touch the inside of your thumb and the outside of your thumb with a Q-tip. But you cannot tell the difference between your abdomen, your chest, your shoulder, because the sensory nerves in your abdomen, chest, and shoulder are all kind of the same.
I did notice a little bit of
Shoulder pain, that's referred pain because it's all the same nerve in your brain. God thought we needed lots of nerves in your fingertips. And there's a lot of nerves in your mouth, and there's a lot in your nose and places like that, but very little in here.
On the inside, is the stomach nerve sensitive or not?
Well, can you feel anything from yesterday? So not very sensitive. Again, what if I had cut off your hand?
Oh, that'd be fine.
Can you imagine the intense pain? Because there's so many sensory nerves, because God thinks that we needed lots of information from that, but he doesn't think you need to know about your colon. Right? You don't need that. So that's why we can give thanks. If we give thanks, I didn't operate on your finger yesterday, because that, I could imagine that just for me, it'd be throbbing and painful, and I wouldn't want to sit here and talk with Dr. Rutledge this morning if I had that. I'd just leave me alone, and boy, that really hurts. So this discomfort that you have, I apologize. We know where it comes from. It's me. And we give thanks it's not worse, because what I did to your stomach is pretty rough.
So how long do you think I can expect it to last?
It's highly variable. Everybody's a little different. So as we go around this morning, we're going to hear different stories. I've already heard from different people already. We have one person.
She's ready to go.
She's laughing and chuckling. I don't even feel anything, right? And then you felt something.
I feel something.
Yeah, and I did that to her because she made me work so hard.
It'll all be worth it.
But so it varies. Everybody's different. Because here's the other funny thing about our surgery. And I'd like to use an example that you may kind of be familiar with. You know your funny bone?
We did it. It's not so fun.
Right. It's the ulnar. It's called the funny bone. It's also called the ulnar nerve. It's a big nerve bundle, and it runs in the slot here in the elbow. So I could hit my elbow on a piece of wood or something like that, if I hit the bone, I can be a really tough guy. I just hit and hit and hit. That doesn't bother me. But just move that impact just a half of an inch and hit right on the nerve, and you know how it feels like an electric shock and everything? You've changed the character. Even though the injury, the impact is the same, no pain, tough. You can even use this as a weapon and hit people with it, you know, right? But then, if you hit right here, so if somebody has pain or doesn't have pain after surgery, sometimes it's not them. It's just that I happen to be closer to a sensory nerve in some people, and you can have more pain than somebody else. Even though the surgery is the same, I hit, I staple, but then I move over just a little bit. Ow, wow, wow. The pain changes just because of a movement of a half an inch in where the staples go. So we can't predict a precise date that that'll get better, but we know from thousands of people it will get better, and usually a couple of days. And think back to clinic. Did you hear all those people? All of them seem fine by Tuesday, the week after their surgery. So we would predict, if all goes well, and there's no guarantee of this. Remember the permit with all the dangers that are out there. But probably you'll be fine about this time next week. Well, think about your thumb. Is there anything you can do to make that better faster?
Maybe not eat as much.
Well, that's all right. So certainly you don't want to take a big bite of anything, right?
I've been eating very small bites, very well chewed,
Right.
and everything. So
How about this? What if I told you to put a cold pack on this? Would that make sense? So what kind of things do you think you should eat to help this?
just like an
Icy cold anything. It's just like an ice pack inside. That icy cold helps a little. Now, it doesn't make this pain go away, right? If you put an ice pack on here and I cut off your thumb, it still would hurt, yes? So, but a little ice pack, icy colds, oftentimes feels a little bit better.
I'll try that.
Yeah. All right, let's see. I'll get it. I was wondering if I could borrow a pen. I put it in my jacket. Thank you. Okay, so your surgery went great. You have the gastroplasty. How's your hunger this morning?
I don't even feel hunger.
I'm sorry?
No hunger.
I can't hear you.
No hunger.
What did you give me a hard time about for an hour yesterday morning? I'm worried about my hunger, right?
No, I was worried about cravings. You know?
Well, how's your cravings?
Well, nothing either.
Huh?
I can eat soup and crackers and everything, and that doesn't make me crave for other things.
Don't you feel different now?
Yeah, I do.
Isn't it wild?
Yeah.
Yeah. Yeah, it's pretty
And
cool.
You said that you didn't change my peptide by wire.
That's correct.
That's the part that makes you feel full?
Yes.
Like, I don't know how much I should eat. I'm just taking a couple bites because I know I should throughout the day.
Right.
But then I don't have that fullness feeling.
Right. So be careful because you don't want to get the fullness feeling today yet. It's not time. Like we go back to the cut thumb again. It's not time to fool around with your thumb yet. You know, after you had surgery on your thumb, you have to wait a couple weeks before you can use it. So in the same way, take it easy on your thumb for a couple of days.
Can you explain the type of surgery she had?
Yes. You know how we make your stomach? You know how we use the staple gun? You've watched the videos and everything? At the end of that, you know, we put a little hole in the stomach and a little hole in the bowel and hook them together, right? In her case, we don't hook it back to the bowel. We hook it right back to where we took it off in the stomach.
Oh, so she just has a smaller stomach.
Right. And she has the stomach cut and the vagus nerve cut. So she has a lot like a sleeve.
Yeah. And you'll talk about the vagus nerve too.
I'd be happy to.
Is that what the lumbar nerve is?
That and the stomach is where ghrelin comes from, right?
You said my surgery was like the sleeve, like, but didn't you say, like, with diabetes and stuff, that doesn't help, like, as much as MGB?
Right, but on the other hand, you're tinier. I can't afford as much help in you as they have because you would go away. In other words, if I give them all the help, it's like if I give somebody chemotherapy for their cancer. If I give them too much chemotherapy, they can pass away. I haven't helped their cancer if I give them too much. You come to me, you need less help. you need a lower dose for you to live. If I give you the chemotherapy dose they get, you won't be here. Your little babies will be motherless. We don't want that. You can't have the dose that they have. And also, you don't need that dose. It's like if we give your daughter a dose of chemotherapy versus you versus some, we change the dose based on your size. So you needed a different dose.
But then with the sleep, was the outcome in like years or whatever, was it not as comparable as MGB?
It's not anywhere near as comparable, but we're comparing it in 300-pound people. So a sleeve can be okay if you don't need to lose any weight. In other words, when they look at you, they go, why are you having the surgery? Right? They would love to be you now, you know. So they're saying to themselves, you know, So if we give you their surgery, the MGB is better because most of the time when we're testing it in people who need to lose a whole body, your whole body. If we take away your whole body, then your family are not going to be happy with me. You need your whole body. All you need is a little bit kind of sanded off around the edges. So. Okay. Christopher.
Yes.
Let's see what we have to tell you. Your surgery took 71 minutes because you brought baggage to see me. You know your baggage? The old gallbladder, right. So when we looked in, there was a bunch of scar tissue, so it took us about 20 or 30 minutes to cut away the scar tissue. Which is okay. And then we did your surgery, and it went great. We bypassed 7 feet. And when a heavy man goes to sleep, we fear things like low blood pressure and irregular heartbeat or things like that, but we had none of that. So how was your night?
It was fine. I slept, on and off. I went to bed at 10, woke up at 12, went to bed about 1. And I felt much better yesterday than I feel today.
Yes.
Yesterday I was ingesting a lot of salt, just salt and water and ice. Like you said, I do really good with ice. I mean, even if I drink the medication, it hurts me tremendously. So when I put ice on that, it goes away.
And remember what we said about your medicine. You don't have to take it if it bothers you.
Well, I take some today.
Okay.
The Benadryl was just like putting alcohol and all that kind of thing.
Yes.
Otherwise, the pain level is not, it's not good. You feel like somebody's sitting on your stomach sometimes. It's up here. You?
It's me. I'm sitting on your stomach.
No, listen to that. It's, sometimes you feel chest pain also.
That's what's called referred pain. Yeah.
Yeah, and to sum it all up, it was a breeze.
Oh.
It's not a solution like the knee that I had. The knee was good, but I was drunk. Took a lot of oxycodone and stuff like that, so I never felt the pain. But this time, little pain, but not very, very bearable.
Good. Good. Should we ask Mom how she? Oh, let me sorry. Is he still in trouble for that? Is he going to be in trouble for saying that?
No. I have to be in the doghouse when I get.
You'd be in the doghouse, right? Yeah. You know what I say? Jewelry. What do you think?
I think he did pretty well. He had some pain yesterday, but he has his...
Good. Remember that the little pump is tiny pain. Tiny. It's small doses.
Yeah.
Don't hesitate to call the nurse and have a dose of the strong pain medicine before you leave. Okay. Do you want to tell us the number of your pain? Remember we asked her between 1 and 10. 1 is you stubbed your toe.
Yeah,
And
the other one is being hit by a bus.
yeah.
Right now, it's 2 or 3.
Okay. If it stays low, then it's okay not to take...
Today, I feel weak.
You feel weak? Okay. Remember, that's the salt water and all that stuff. And weak also, remember we gave you so much anesthesia to knock you out.
Yeah,
Yes?
I don't think anybody does much salt as I do.
Okay.
I went and bought this Himalayan salt and I take a lot of it.
Yes. Okay.
One cracker?
Half a cracker, that's all I ate.
Hungry?
No, I never would be hungry with the stomach still feels like it. No, I'm not hungry. I had the juice, that was really good. The beets and carrots and celery.
Yes.
I think that was really good.
Good. Good.
Only have like half a glass.
Questions? Anything not clear, or anything we can answer for you, or?
No.
Okay. What we think is, for the rest of you, is that you spend the day today. Excuse me. That you spend the day today just doing what you're doing now. Sitting, walking around a little bit. Make sure you can go to the bathroom and pass your urine. You won't have a bowel movement for several days, so don't worry about that. Make sure that you can drink your icy cold liquids. And then sometime between 3 and 5 this afternoon, call the nurse to come check on you. And if all is okay, you can leave. And then
He
you,
said he can leave today after 3.
if you continue to do well. If he doesn't do well, then we stay.
Okay.
Yeah. But you keep a watch on him. If he does okay, then he can go. If not, then he stays.
What about sugar?
Sugar's fine.
Because I think somebody told me that Gatorade, that he don't like Gatorade, that only had like ice. No, it has some sugar that helps.
Sugar helps. Sugar good. Yeah. For diabetics, before surgery, sugar is bad. Now, in the coming weeks, the sugar helps you feel better. It helps your strength and it helps your recovery. Candy is okay, yeah.
But they gave him 2 shots of insulin.
Right. His sugar goes up after surgery because of what's called the stress response to injury. The stress response is a common response to any kind of stress on the body. It goes up with anger, with fear, with trauma. When we were living outdoors and we had to fight a saber-toothed tiger, and when we saw a snake, when the people from the other village came to steal our women, then suddenly we would have a flooding of our body with sugar, adrenaline, cortisol. I'm ready to fight or to run. And the same thing happens when you're asleep with the surgery. Those stress hormones, cortisol, adrenaline, and things like that, are released into the bloodstream. They flood the system and his sugar goes up. Sometimes people who are not diabetic but are pre-diabetic show up as diabetic after surgery because of the stress hormones. So it's not surprising that he has elevated sugar after surgery. It's not surprising that you have pain and discomfort after surgery because of the powerful impact of the surgery on the body.
So if his sugar level was high, does he need, a candy or something?
Yes, he still takes it. His body is doing the right thing. It's flooding him with sugar. Now, for the rest of his life before this, extra sugar in him, no, he doesn't need that. But now, as a recovery mechanism from the surgery, it's okay. It's flooding into his muscles. It gives him strength. It makes his brain work better to have extra sugar, things like that. And that will naturally go down as he heals.
Would the fruit be better than candy?
No, I don't think so. I think the sugar is probably okay. But there's nothing wrong with fruit. Fruit and legumes are okay.
Got you. I'm never going to have the end.
I will always remember you as my patient with the legumes.
So do we have to test his sugar level when we go home? He has.
Yeah, it's not a bad idea to check it. We expect, because we do this so often, that his sugar will go up with surgery and then down, and he will be cured of diabetes. If he has severe diabetes, then we check it frequently because we worry a little bit. But with mild diabetes, we see it almost 100% cure.
How long time? 2 months?
Everybody's different. The worse the diabetes, the longer it takes to cure. So if it's mild diabetes, sometimes we'll see it in a couple of days. Severe diabetes can be months, and occasionally we don't cure diabetes at all, but less than 7% of patients do not get cured of their diabetes in our last survey.
And those are like heavy diabetes
Yeah,
patient.
yeah. Okay. Yes.
Do you only take that when you have pharmacy? Or do you always take it?
I like melatonin so much, I think it's not a bad idea to take it every night. It's good for growth hormone, which is good for you. It's good for the lining of your stomach and healing that irritation you're having. It protects the lining in the future from ulcers and things. So I think it's a good thing.
How much do you take?
There's no upper limit.
Oh, really?
Yeah.
because
Girl said 20 milligrams or something.
you can find 5 milligrams and 500 milligrams.
Yeah.
I don't think you can find 500.
I have.
Maybe 500 micrograms.
No, it said add 5
Chewable.
mg.
I don't think so. I bet you it's 500 micrograms. I'm guessing.
Because it's, I mean,
We can. We.
it's a big difference.
Are you talking about the Trader Joe ones?
Yeah,
Yeah,
chewable.
it's like, we give those for the kids, so I'm sure it's the small, the.
Yeah.
My grandkids take that.
But you can just. Yeah, I would take it. I think it's.
I only saw like sleep. It's for sleep or something like that. I
That's
thought
right.
maybe
There's
that-
new research since that was published, and they have to be careful what they say. And there's.
Okay, everything.
My bias is that it's a good choice for you. All right, Gail. Surgery is 32 minutes.
Yeah.
Yeah. So we should give you kind of part of your money back, right? It's so short.
Isn't it overall? They kept saying, "What are you in for?" I said, "From toe to head." You know, I want the works. Overall.
7 feet bypass.
Okay, and the smaller. If I had done a 5, would I have lost more weight?
No.
Or is it 7 more weight?
No. The gut is there to digest and absorb fat. The less of it you have, the more weight you lose. The more we bypass, the less of it you have. Want me to say that again?
Yeah.
Okay. Your gut absorbs fat and calories.
Right.
Why did God make it so long? It's 26 feet long. Because he wants to absorb that food. If we took all of it out, you would starve to death. If we take a little bit of it out, you lose some weight. If we take a little bit more, you lose some more. She had 0 bypass because she's tiny. The heavier you are, the more we bypass. And it's a guess on how much to bypass. Remember in clinic on Tuesday, we saw the woman who's kind of borderline too skinny. So 7 might be wrong for you. The other thing is I have no idea really what it is because the gut is like the edge of the ocean.
So what happens? I just can't get below a certain weight, or what? When in the future? I mean,
What happens in the future?
yeah.
If I knew that, would I be here talking with you? I would.
Okay.
I'd be on a beach in Hawaii. No one knows. You mean what is probably going to happen? Is that what you mean?
Yeah.
You'll probably lose a lot of weight.
Okay. Yeah. Okay.
I get the impression I'm not really answering your question
No,
though.
you are. It's just
Okay.
that. Well, you know that I may get down to 150, I may get down to 120. You just don't know.
That's right. Exactly right. And I use my best judgment to bypass 7 feet from my past experience. But if I say I bypass 7 feet, I really have no idea how much I bypass because the gut is like a slinky.
Right.
It's changing moment to moment. It's like the ocean. Depending on if you drink some soda pop with some gas, it stretches it, and then if it goes down. So 7 feet I may be perfect in you. Or you may say, that guy, what a quack. He lost too much and I got too thin. Or I hardly lost any, I hate him. But most of the time, I'm pretty good. The other thing is now we have people who are a decade out. And we know everybody gains a little bit back because the gut adapts over time. But that still blocks us from how much we can bypass on the first year because you get to a minimum at the end of the first year. And then if we look at the gut over a decade, we know that inside the lining thickens up. It gets long, what are called villi. And it helps digest more. So a decade out, we see people gaining 10 or 20 pounds back on average. So all that is in the mix of your future. And we don't know which future you will get.
Yeah. Well,
But we know if we had the tragedy of bypassing too much in you, we can fix it in 30 minutes.
Yeah.
And if it was a tragedy where we bypassed too little, we know we could fix it because we bypassed more.
Yeah. Well, I feel like now I'm going to be eating to live instead of live to eat.
Hungry?
I'm not craving anything, but if someone brought in a hamburger, I mean, the only thing I could think of is eating a hamburger. But I'm not craving it or, needing
But it feels different than yesterday.
Oh, yesterday I could eat a hamburger.
Right.
But I know I can't, and that's okay. I drank 2 cans of Gatorade and 2 V8 juices and the broth from my soup, no problem. It's been sucking on the pretzels with the hard kosher salt on the outside, and I haven't had any problems. And like you said, like 3 baby spoons, and I've been able to do 6 tablespoons or whatever, and I haven't come to a point where or anything. I was awake when they took me to the surgery room and put me on the gurney, and probably 5 minutes later, I was out and didn't wake up to the recovery room, and it was like that thing that I had a long time ago. When are you going to operate? I didn't feel sore, or of course I was on pain medicine. The only place today that I didn't have yesterday is a little soreness, and the only place I feel is right in here around my belt, opposites on each side of my belly button. What's here besides that?
Well, it's Teresa could ask me what's here.
Right.
It doesn't make any difference because
Right.
that's not where your pain is. Your pain
Yeah.
feels that way
Right.
because of referred pain. And so I'll tell my broken shoulder story. Okay? So I came in to see one of my patients the morning after surgery, and I'm really blessed. So many people are so nice to me. So this very nice lady, Dr. Rutledge, you're wonderful. Thank you so much for taking such good care of me, but I think you broke my shoulder. And I you shouldn't laugh with somebody's pain. So I kind of laughed. I said, no, I don't think I broke your shoulder. She said, no, look, I'm not angry at you. I know you're a wonderful doctor, and these things happen, but you broke my shoulder. I said, no, you didn't break your shoulder. She said, look, I'm not going to sue you. I understand maybe you dropped me when you moved me from the table or something like that. I'm not angry with you, but I have had a broken shoulder. I have had a shoulder fixed by an orthopedic surgeon earlier this year. This is a broken shoulder. I know what it feels like. And so I went through and explained about referred pain and all that stuff. And super nice lady, she thought I'd broken her shoulder. I didn't break her shoulder. The nerve in your brain that goes to your shoulder, your chest, and your abdomen, all the same nerve. Have you ever heard of somebody has a heart attack and sometimes it hurts in their shoulder or their jaw? It's the same thing. It's called referred pain. So when you say what's here, it's a question that doesn't have an answer because we don't care what's here.
It's just that I'm
I
walking
know.
around and I could notice it, but if I was busy, I mean, it's really nothing's there. I mean,
Right, and we
fine,
give
all
thanks for that. What that means, what that's telling us, is that the pain is mild.
Right.
And it doesn't mean that the injury was mild. The injury, the trauma, the damage to your stomach is major. We just give thanks that we were working in an area that doesn't have all the nervous system, sensory nerves that your fingertips do.
Well, now when the pain medicine wears off, will I start feeling?
You sure could. You sure could, right. Right. That's why we give you that long-acting anesthesia, because we want you groggy instead of wide awake.
So
And
they gave me an oxy pill, and I don't want any more because it makes me feel groggy.
but why not be groggy?
Well, yeah, that's why I told her since I'm leaving, give me what you have, but I don't think I'll have any more.
Yeah,
so I
yeah. Now, here's the other thing, and this is sometimes something we talk about with our patients. A lot of doctors, when you go home from the hospital, give you pain medicine. And they give you strong pain medicine. You may have heard of Lortabs or Percocets or oxycodones or codeine, and we don't give you any of that. And the reason is it's highly radical to discharge you on the day after major surgery like this. Everywhere else in the world, for years and years, you would stay in the hospital for a week. We feel comfortable sending you home as long as you feel well. If you had more pain, we were happy to give you pain medicine as long as you stay here in the hospital.
Well, I'm elated how, like I said, I don't feel like I had an operation or anything.
Great.
And
We have to get you on video.
Yeah, and it's great. Like I said, I had to go shopping right now. I can do it except for the drugginess, and TV. I'm a TV-holic.
Mhm.
Haven't cared to watch TV or surf the channels, or probably because I'm druggy or whatever.
Mhm.
But and last night I went to bed around 6, and they didn't bother me till 12, and they didn't bother me till 6 this morning. So I had 6 hours of straight sleep.
Good.
And I'm doing well, you guys. This is amazing.
Good.
Amazing. So, and just to be able to drink as
We are
much as I
jealous.
did.
What's that?
This is we're jealous.
And so I thought I'd be able just to eat 2 little bites, and I'd be, and And so, but it's good for me to have a lot of liquids, and I thought I wouldn't like Gatorade, it's fine.
Good.
And someone had suggested these long cigar pretzels, and they're just fun to suck on and put in the trash and get another one, and, you know, I've got my pacifier. And a wonderful doctor. Love you.
Well, thank you.
Love you, love you, love you.
We're happy.
And like I said, I had my gallbladder out, and I thought that was a cinch. I think it was a little bit more recovery than this, because I had a day surgery. But wow.
Good.
So I'm going to email it to everybody when I get back home.
Well, we're excited. And other questions? Anything else we should answer for you? Or your husband, any questions?
I guess the only question I have is about salt.
Yep.
Sometime back, and it's been quite a while, I don't remember what it was, but I had gone to see the doctor. I don't remember what it was. I kind of think it was like loss of equilibrium or something. And I saw the doctor, and he said, "You have to cut down your salt intake."
That's right.
So I'm looking at this, the encouragement of using so much salt. I mean,
Right.
is there
Because
any
she
danger?
is no longer like you.
Okay.
The MGB challenge changes her so radically that all the things that you just said, which would be right for her yesterday and the day before, are no longer right for her. The new surgery, the new her, changes everything. She is going to be flooding out her salt and water. Remember the people in clinic that you saw, where people raised their hands and people had lost 12 pounds? That's 12 pounds of salt water they lost. So unless you keep up with that salt in her new life, then she will actually get dehydrated and weak and tired. The surgery itself is tremendously powerful. It was so powerful that I feared giving it to Teresa. I feared that I would kill her. I mean, it's that powerful. And again, remember you heard in clinic, you can't go against it. In other words, you could have a bite of fried chicken after this surgery. But if you have a lot, I will come to your house, I'll find you, and I'll punish you. You know? So it's, again, also, I think of it this way. My patients have spent a lifetime fighting a foe, battling an adversary in a war against this very powerful bad guy, Goliath. And every day, kind of in this biblical battle, you have been sending out your heroes to fight Goliath. And at the end of the day, they come back beaten. They come back on their shield. Obesity has been this unconquerable foe. And what have we tried? We've tried diet and exercise and high-fat diets and low-fat diets and riding a bicycle and eating a vegetarian diet and failing and coming back at the end of the day. Now we send out the MGB. This time we win. But he can't win against Goliath unless he is equally powerful. And the MGB is powerful. And with, as they say, the cliche, with great power comes some risk. But it is extremely powerful. And that's why there's the difference in what you hear from your doctor who told you cut back on your salt. Because you and I are average Americans and we can't have so much salt. She has transitioned. She's now an MGBer. She's now different. And salt for her now is going to be forever different because of the tremendous power of this surgery. And it has to be powerful because it's going up against Goliath.
And I love it because people always think, my sister goes, taste your food before you put salt on it. I mean, I'm just a saltaholic.
Yeah.
Now it's in
And
my doctor's
all your whole
orders.
life before that, bad you.
Right.
Don't put that salt
Make
on
me
there.
feel guilty.
You're bad. It's bad for you. Don't do that. And that was all right up until today.
So do I also have the salt thing too?
In smaller. You have a junior version. Everything that we say for them is smaller and lighter and different for you because you came to us with less of a battle.
Is the salt intake just for the recovery time or
Forever.
No, forever?
10 years from now, if you're not paying attention, you get up in the morning and you skip breakfast. You rush to work and don't eat at work because you're busy. And you go to drive home after lunch and you skip the little bit of lunch and you pass out driving and drive off the road. And you call me and say, Dr. Rutledge, what happened?
It's like
Not enough salt.
like people with the salt, nothing, and I felt all the time tired. And then I went to that cafe raw, and I found a book about the people with thyroid, and it said you need salt. So I had salt, and right away I
Feel better. Yeah. Because your body is different. Each of us, look in the room, we're all different. Yeah, yeah. Each of us is different. And so no salt. No salt. Bad salt, salt. Blah, blah, blah. I can't use salt.
I love salt.
I love salt.
And my throat, no problem.
Okay.
And I'm lucky to have you and Sandy and Trish. But the nurse I got, Noreen, was fabulous.
She's had the surgery, yeah.
She was a patient of yours. I forget all the tips she told me, but it sounded good. I said, I want your email. Anyway, I just feel like a princess, just lucked out, and I'm at the best party ever.
Yeah.
And I haven't told a lot of people about this because I felt that would be more valid after I had the surgery. But everyone's getting your website.
Well, thank you.
Yeah.
Good.
And
Or-
also, I would love one day if you did a bio on yourself. When we talked in the hallway a little bit, and you told me about your dad and Dale Carnegie, and it'd be so neat to hear all that, how
Sure.
you became who you became, from
Sure.
your family, from your education. I think that would be so great for people to hear.
Sure,
You know, I felt I knew you because of your videos talking to you, but on another level, it really would have. I couldn't find it on Google. A real, neat bio.
Some more of the background,
Who is
yeah.
this man?
Sure. That'd be fun. As I'm embarrassed to say, I love to talk about myself, so there'll be no problem.
Yeah, I want to see it on YouTube.
Okay, all right, enough about Amber. Amber was Miss Trouble. Instead of 5 ports, she has 7.
Oh.
And every one of us, we're all shaped differently, and she has a little bit of her weight kind of right in a little spot where
Preschool, there's nothing. I don't get that.
right, and then there's a spot. So everybody's a little different. So that means where we put our ports, they weren't quite long enough. So we had to wait a few minutes and get the slightly longer ports to go through that one little spot. And then the rest of the surgery went smoothly, and but I had to work a little bit harder. And so her surgery took 96 minutes, so an hour and a half. So
I'm feeling it today.
you can feel kind of beat up.
I feel it.
Yeah, because she made me grumpy, so I pinched her while she was asleep. But otherwise, the surgery went great. We bypassed 7 feet, so that's a lot of bypass, and hope will be good for you. Questions?
No, I just had that question about being dizzy, so you answered that.
And the medicines make you dizzy. Again, they make you dizzy.
Besides, I'm really super tired today. I don't know if it's because I was under anesthesia for so
It's
long.
because of the anesthesia still in your bloodstream. We use longer acting. That if you're super tired, what should you do?
Eat some salt.
No, sleep.
Well, I've been sleeping all day.
Good, you're doing the right thing.
I
And
sleep, get up, go to the
remember in clinic we had like a couple people, they said for the first 3 days they were fast asleep. They didn't even wake up for a couple days. So
And I feel like I could do that.
yeah, and we prefer that to being wide awake and feeling the pain of the surgery.
As long as I lay down, like right now, my pain will be like a 7-ish.
Right. Have you had some pain medicine?
I did a while back.
A shot or a pill? Okay, the pill is a baby version of the shot. So the good stuff is the shot.
I need to tell her to give me a shot.
Yeah, you need to say, I have a pain of 7, and Dr. Rutledge has an order for a shot.
Okay.
And that will make you feel better.
And then the other thing, this might be TMI, but when I was in the recovery room, I could not stop peeing. I filled up a whole bucket.
That
Lady, I think
is
that's
salt
crazy.
water already working. Yeah, in other words, that's salt water already coming out. And you're kind of surprised sometimes to see the surgery work that quickly, but that is the salt water already coming out.
That nurse was like, "Are you done yet?" I'm like, "No, I'm not. I'm still leaving here."
Yep.
I think also your nurse told me that you said you had blurry vision.
I do.
So I told her that's.
The patch. Right.
So, we didn't find.
It's only when I was trying to read my phone, and I'm like, I can't read my Facebook page on my phone. I cannot focus.
In my case, it's because I'm
I can't
50.
focus on you. Right now, you're blurry.
That's right.
So-
That's it. In my case, it's not the patch, it's that I'm old.
Well, and the patches they put on us, they said just keep on for 72 hours or till you leave.
You can leave them on or take them off. One patch helps slightly with pain, but only slightly, and the other helps slightly with nausea, but only slightly.
Yeah, she told me that I could leave mine on until Saturday afternoon.
Well, I have to tell you, I was, so I don't know what came over me. We were going to take a picture for something because I wanted to send my sister, all the Gatorade and stuff like that. And then I said, oh, and then she was changing my gown, and I said, okay, you finally get to see the whole me, because I felt confident I'm never going to be that way again. And in case I get stuck, you know, I want to be able to see that. So we took a front, side, and back nude picture of me, and I don't feel horrible about it because it's not me anymore. And so I was confident enough to be snapped and photographed.
Yeah, you can rub me up anytime. It'll be worth it.
Never again. It's just that once, and you're the one who roughed me up. That's
I did when I had my foot surgery. My body's just weird. I had an extra tendon in my foot that most people don't have, that my sister was growing in. So I just have a weird body.
Other questions?
Just wondering, like, what does this, are there any studies on how much weight I'm expected to lose with just the gastroplasty?
Yeah, basically, we expect you to lose roughly 10% of your body weight in the first month or two. So we would expect a 10 to 15 pound weight loss in the first 1 or 2 months. And
then after that, like,
then it drops precipitously. And if you remember from high school math, it's a logarithmic curve. Biggest drop, slightly smaller, really smaller, and then trickle, trickle, trickle till it finishes a year from today. And sometimes it doesn't finish a year. Sometimes finish 2 years. Sometimes.
there'll be plateaus. I've been reading a lot about that on the network.
Right. Now the way the plateau works, and that's a really good question, is people will have this big weight loss, and then they'll be tense, and they'll email Flo and I in capital letters going, oh my goodness, the surgery's not working because I didn't lose any weight this month. And this goes back to something unusual about a person who's heavy body, and that is when you lose weight initially, your body is burning, we wish it was burning fat, but instead it burns muscle. In other words, it shouldn't. It should. Remember we told Ebenezer Scrooge, just watch it, we told that whole story in clinic. Your body should burn fat because you're eating fewer calories today, and it's got all this fat, which is stored calories, and it should go burn those calories, but against our wishes, against your will, it burns your muscle. Shoot. Now, it's going to burn your muscle and burn your muscle and burn your muscle, and we're going to hate it, hate it, hate it, but finally, your body needs a certain amount of muscle. It needs muscle to walk and to breathe and for your heart to pump. And so at some point it's going to say, no, you cannot have any more of the muscle. I'm going to release muscle building hormones, what are called anabolic hormones, to build up. And so some muscle will be put back on, and against his desires, Ebenezer Scrooge, who's in charge of the fat in your butt, will unlock the stores and let some of that fat come out. And your body will burn that. Now, on the month in which Ebenezer opens up the bank and lets out some of the fat to be burned, your body will build muscle and burn fat, and you may not lose any weight. But if you measure your waist, you may drop a half an inch, you may drop a dress size. And so we get this phone call. People call us and say, this is terrible, it's terrible, I haven't lost any weight. And I'll say, well, this is this. I said, have you noticed a change in your waist at all? And I got a call from this one older gentleman, and he said, it's funny you mentioned that because I was gardening the other day and my pants fell down. I said, well, so measure your waist also. And if you want to, you can measure like your arms and your neck and things like that. But we have people come back to clinic, with the belts, with all the buckles and where the belt has been. But you may have a day or a month or a week or 2 months where you don't lose any weight, but you lose a dress size. And that's building muscle and burning fat, and that's what we want. We want that to happen. It's got to happen for your health. And then you've got to have some plateaus as you come in for a landing. So as you start dropping down out of the sky, like landing a jet, we want you to slow down and safely come in for a landing next year. That's when the weight loss kind of stabilizes on average.
So is that last 20 pounds?
When somebody who has surgery, when can this person start working out?
Right away.
Right away.
Immediately.
What kind of?
He can lift weights, he can mow the lawn, he can do laundry, he can change the bed, he can vacuum, all those things, do dishes, all those things are good. Yeah. And here's the question. You may have heard no heavy lifting for 6 weeks after surgery. Ever heard that?
Yeah.
That's because you have a big cut. Okay? We have a little tiny cut in the skin, and then we take a plastic tube like this, we call them the port, and we push it through the belly wall. And the belly wall is a lot like these Venetian blinds, so that when we come out, it snaps together. So you can lift weights, you can do anything.
And how big is this? You said the stomach's like a marker?
That big pretzel you had
Uh-huh.
this morning, big magic marker, cigar, something like that.
Wow. That's why I was amazed how much I could drink.
Well, because it's not going into your stomach anymore. It's like, does it make any difference how big your esophagus is on how much you can eat? Have you ever thought of your esophagus as blocking your eating? No, because it goes straight through. Now your esophagus connects to the stomach, which is now like the esophagus, and it drops straight into the small bowel. And if the small bowel is moving, then you could drink a lot, and you could eat a lot. If the small bowel is still and quiet, it'll fill up very quickly. So there's variability because there's no more stomach. It's just an extension of the esophagus.
And is it wise just to drink as much as you can?
No, I'd say put it differently. If you're thirsty, you drink a bit, and always very small amounts, very slowly, and very well chewed. And as long as you follow those guidelines, you should be fine.
Like a fourth of a cup?
Even less. Just go slow. Other questions?
Not really. I think I'll just have to wait and see how it goes, like how much I lose weight.
Right.
'Cause I'm hearing 15 pounds, in a week and everything.
Not for you, we hope.
For me.
No. If we get that, we're going to be scared. Questions, Chris? That's okay. Sleeping's good. Gail, last questions?
I got your number.
Right. Amber, any other questions? Okay. Well, since we're finished, I'd like to introduce, we have a very, very important person, a VIP who's visiting, Flo, who's visiting from Florida. And so, Flo, can we say hi? Hi, Flo.
Hi. Hi.
We're happy to have you here. You're wonderful. So how are you? What's up? What's going on?
Great.
Are you keeping an eye on Dr. Paragli there in Florida?
I'm keeping my eye on him, Dr. Rutledge.
Good.
Everything's going well. It's hot as hell in Florida. It's so nice to come here where it's cool.
Yeah, that's what we're known for. Cool weather. Las Vegas, cool weather. But it's hot and muggy there.
They have humidity. We don't
And
have
plus they have oil on the